Good day, everyone. I am Darlene Pecache, an adolescent medicine specialist from the Philippine Children's Medical Center, Quezon City, Philippines. Suicide in the Philippines has not been given much attention because of the stigma against people with suicide tendencies. However, rates have been rising in our country, and suicide is the second leading cause of death globally among people 15 to 29 years of age, according to the 2014 Global Report on Preventing Suicide by the WHO. Screening for suicide is important in suicide prevention. We need a tool that is both reliable and culturally valid. At present, there is no validated suicide screening tool locally. This will be the first study to translate the ASK, or the Ask Suicide Screening Questions, into Filipino and then validate it among Filipino adolescents. This was the general objective of my study. This is the flowchart showing the steps of translation of the ASK. This is a flowchart of the process of data collection. For content validity, item level content validity index was computed using the proportion of experts who agree that the item is quite or highly relevant. An ICVI exceeding 0.80 means that the experts deemed that the ask had adequate content validity. For face validity, descriptive studies was used to summarize the feedback, and comments were listed. For construct validity, confirmatory factor analysis was done. Absolute fit indexes such as the chi-square goodness of fit, the root mean square error of approximation, and the standardized root mean square residual were calculated. The CFA turned out to be acceptable. For internal consistency, the overall Cuddy-Richardson coefficient was at 0.366. A higher coefficient was found in the English version compared to the Filipino version. In the Philippines, there is a growing attention in mental health and well-being, especially among our adolescents. For our study, the content and face validity were acceptable. Construct validity was also measured to be accurate. The willingness to answer a suicide screening tool can be affected by age, sex, religion, and ethnicity. There are also confounding factors, which include literacy level of the population, the length of the and wording of the tool, interpretation of the wording in our local language, but most importantly, nation. Stigma could also be a factor, as well as social desirability bias. The Filipino version of the ask had acceptable content and face validity. CFA was a good fit. Construct validity was acceptable. However, the ASQ had weak concurrent validity against the PHQ-9, and internal consistency was low, which may be due to inconsistencies in answering, interpretation of terms, and the nature of the construct of interest, which is suicide. Despite these limitations, the results suggest that the Filipino ask has a potential to be a valuable tool to assist healthcare workers in screening for suicide among our adolescents. Our effort to validate the ask is a useful step in this direction. We believe this study will encourage additional interests on mental health and suicide research among adolescents. Thank you.